Every environment has hazards in it. They all do. They all do. And it's not about the industry. It is about, can I recognize the hazard in this environment, the degree to which I'm vulnerable to it, and the associated risk with that vulnerability? So those concepts are really important. Hazard, vulnerability, risk. They all go together. And what I find is that folks skip over the first two and they want to talk about risk management. Well, how can I manage risk when I don't know the source of the risk? I don't know where the risk is coming from. I just know that, and I look at the outcome, or someone slipped and fell, someone was exposed to a chemical, someone contracted MRSA. I mean, pick your thing, but there was a hazard that we did not identify on the front end, and a degree of vulnerability that we did not assess that caused us to have risk in the first place. So I would say to you, in healthcare, if I were to do a job hazard analysis, and that analysis really is not a difficult thing to do for those of us who know how to do them, the first thing I want to look at is the environment that the person is going to operate in, and what hazards are they going to be exposed to. Some of those hazards will be physical, but a significant number of them I'm going to venture, because I was involved in the pre-hospital healthcare system as an emergency medical technician. Same industry, just on the outside of the doors of the hospital. I had more physical risk or more physical hazards I was exposed to. But what's consistent across the board are the psychosocial hazards that we're exposed to in healthcare. And so generally, I separate hazards into two categories: physical ones and psychosocial ones. We know a lot about the physical ones: biological, chemical, ergonomic, slip, trip, construction, natural. You pick them, but they're mostly about the physical manifestation of something that could potentially bring me harm. What we don't have a lot of conversation about, which is really important in healthcare, and in any non-heavy industrial type of environment, are the psychosocial hazards. And my definition of a psychosocial hazard from my research is, a psychosocial hazard is any work-related factor that is perceived or experienced by the person exposed as a threat that causes them to behave differently. Perceived, something comes in through my eyes, ears, nose, mouth, whatever. I perceive it as something that, based on my experience, could potentially harm me in the future. So to you and to me, psychosocial hazards are going to be very different. Some will line up exactly the same, but some are going to be very different because of my experience. My perception may be identical to yours, but my experience of that same thing is different, and it causes my amygdala to fire up, my prefrontal cortex to kind of shut down and go like, hey, that's a threat. I need to figure my way through this before I can have a otherwise intelligent conversation with you, because there's something going on that doesn't cause me to feel